Hi everybody, a simple clinical tip in this video. It's good to do a lateral compaction, but not when many cones are reaching to almost the same length, especially in wide, large, open canals. In large canals, please think of only a bioceramic way of obturation. The rolled cone and the inverted cone also didn't work that good, simply because the apical diameter is very large to prove success. This is a case of retreatment wherein toto I could pull out the entire mass of GP with the help of an H5. What looked a very cohesive bond at the entry point, now you see, when the whole thing came out, it didn't come as bad on the radiograph because the GPs may have been overlapping, but there's no sealer between Gadapacha to Gadapacha, which means it's not a binder. You need to have some amount of sealer, which is a binder, adhesive between the Gadapachas, and I find it not there. This is exactly what happens at the apical end, which is the zone of infection, which is the must to have in case of to have a successful root canal. So please make note, in wider canals, larger canals, you always need to have some different type of obturation and not a lateral compaction. Thank you so much.